Hello and welcome to a video training on postnatal area of Badgernet for UHS. So it's Alana here, one of the midwives working on the project. I'm going to take you through our postnatal section. I'm hoping that most of you are pretty up to date with your navigation, so I'm not going to go through that too much. Once a baby's been born, we can see on our pregnancy summary page, once we've selected our patient, that we have a labour and birth section visible. So obviously, whenever we go into a situation, we have that summary of all of our risks and what's happened during birth. It also has carried over intrapartum risks as part of their risk assessment as well. So I'm going to go into the postnatal section. I'm just going to focus on postnatal women and people. There is another video on baby care. This is specifically for postnatal women and people. So obviously you can see along this top line that this person delivered at 26 plus 2 weeks, and they are 26 hours postnatal and they're currently under the care of the hospital. For the purposes of this video, I'm going to pretend that this person has just arrived on postnatal ward, and we're going to go through a few things together. So obviously at the moment we don't have a date for today, so we need to start today's date by creating a postnatal assessment. So this opens the start of your day. If you imagine it like a book, we put the first page in, the chapter heading, and then we add all the pages in as we go. So if we go to our postnatal assessment, it brings up this form, and obviously we need to fill it in as appropriate. So again, as you've probably been told before, the bits that are in red are mandatory. Anything else is up to you, how much you fill in. Obviously, the more detail that you put in, the better. So we're going to say this is a face-to-face assessment. Location postnatal ward, the reason why we're doing an assessment, so obviously we have got postnatal care of the mother carried out by, obviously we can search for our person if it's not us, or we'll put our name in by using current user. And if there's any others present during this day, so potentially maybe a student midwife, or it might be obviously, as in COVID times, the person is on their own. And again, have they given their consent for procedures? This is asked on a regular occasion to make sure that people know that we're gaining informed consent. So we'll go yes, save and close. So it's now obviously on my postnatal page created a day in green, so that obviously it signifies that we're giving postnatal care today. If we click in that, it then shows that initial postnatal assessment that I started over here. So we now need to add today's pages. So obviously one of the first things you would potentially do is you may write a note. So obviously we have a new note over here. It doesn't always carry everything that you might need. So if it's missing something, you can do enter new note, and obviously on an iPad it's search and record. So I'm going to search for a note and I'm going to do a clinical note. So obviously I'm going to say that it's me. Obviously if we do lock from changes, it means that you can't go back into that form and change anything that's written. So obviously we should do that as a routine, but if it's something that potentially someone may need to add to, you would put no. So type of user, so we have midwifery at the very top, and a clinical note, so I can put it's clinical. Obviously in some cases we may need to use this note in social. So obviously if we click social, it basically makes it a social form. So anything we write in here will also go into our social tab, which is on the left hand side in the menu. For this case, I'm going to do a clinical, and I'm going to say arrived to ward. Okay, we have access to be able to draw any visual things that we might be seeing. So if we can bring this up, and we've got obviously visual illustration of a woman. where we can obviously say maybe they've got a sore point here on their arm after their cannula. They may have obviously their cesarean section wound. You can obviously record as appropriate. If you want to go back and look at that image, you go to where it says woman illustration, image available, and click, and it comes back up again. If you put confidential, obviously it means that no one else can, no one apart from our clinical people can view this message. If we untick yes, it gives us the option to be able to publish to MatNotes. For those of you that don't know, the MatNotes is the app that the people have that we can send any information over to them. So obviously, potentially, you might not want to do it at every meeting, but there's certain things that you might want to send over to them. For example, I think this can be quite a good place to copy your feeding plan into. So there's a separate place to actually record what the feeding plan is. But once obviously it has been done, you can then copy and paste it into here, and you could publish it to MatNotes. So obviously the women and people have it visible either on their phone or on a laptop or portable device. So obviously I can do save and close, and that clinical note will appear there. If I want to view it more, I click on the title. If it ever freezes, go back into your menu, click back onto where you were, and reopen it again. So we've got clinical note, and again, you can see there's an image available, and I've put arrived onto the ward, welcome and orientated. So now I'm going to do an assessment. So to do that assessment, I will go into observation. So that's my daily check. So again, I've got a mandatory, so I'll say yes. My location is postnatal ward, and it's completed by me. So obviously we've got comments where we can make on the general condition. You have a section for your OBS. Obviously our MCAs will routinely be doing this for us. So we don't necessarily have to fill that part in unless you've obviously done it physically yourself. If you want to comment on anything else, then that's absolutely fine. And obviously if they have put in any observations, it will create a Muse score here for us as well. And then you can say what action you have done. If there's any triggers for sepsis, you've got obviously an option list here as well. The next section is your routine daily check of the woman or person. So you've obviously got breasts, you can comment on there. Again, as you go down the list, you've got all sorts of different things. So for the examples of this video, I'm just going to mark it all as normal. So no problems, uterus, well contracted. Obviously, we can say whether we have offered an inspection. If we haven't, it will ask us for a reason as to why we haven't offered that inspection. Obviously, potentially if they are post-cesarean section, or they might want it to be checked in the next, well, you've already had that discussion where you want it to be checked in the next day. If you say yes, that you have offered it, but obviously they say no, you can obviously say why they have declined. So maybe they want a shower. In this case, we'll say yes. So obviously our perineum and how it's looking. So I'll say clean and healing. And again, we've got local amount. And we can obviously go through these as we go down. So if we obviously we're just postnatal and potentially they haven't passed urine yet on the labour ward, we can complete when their first void was. So if we do yes, we can then put a date and time as to when that happened. So if you're filling it in on the desktop, a quick way to fill in the date and time is to type the letter T, and on your keyboard press the tab button, and it fills in the date and time for you. So I'm going to put that this person had a 300 ml urination, obviously bowels, so we can say potentially no problems, or obviously if they've not opened their bowels, that's there. It does ask you obviously about stool type, but if they've not had their bowels open, you don't have to comment. You have you discussed about the pelvic floor? So maybe you've talked about pelvic floor exercises or other, maybe it's not appropriate. Obviously our signs of DVT, Any pain, obviously areas of pain that they might be having, whether they've got a good appetite or whether they've had any sleep. Obviously, in most cases, that's probably going to be poor. You also have another illustration of the perineum. So obviously, if you are looking at anything and maybe you want to draw on specifically where you've noticed areas are maybe red and inflamed, you can obviously draw that onto your diagram there. And again, you've got another illustration of a woman. If you want to add anything extra, you can obviously add this into the free space at the bottom. So I'm just going to so again, you can say whether you've reviewed the management plan and also if you want to publish this to the map notes. Obviously, I would recommend discussing all of this with the person as you go along, so that if you do send it to the map notes app, they're not surprised by what they're reading. So if we do want to send it to the app, when we press yes, it will make us authorise it. So we will have to enter our username and password to be able to sign that off. That obviously stops us from being able to publish things that we don't necessarily want to. So obviously we say no in this case. So I'm going to do a save and close. And again, that observation has appeared there. So I'm going to look a little bit at some postnatal education and conversations. So in my add new note, I know that these are listed down here. So we have postnatal conversations. So we can put what number contact that is, who it's been completed by. And obviously this is mainly relating to feeding. So obviously, depending on what you tick will bring up different questions. So if obviously they are just breastfeeding, it will just bring you up breastfeeding questions. If they are doing formula feeding, it would just bring up formula questions. So again, it's not necessarily mandatory that you fill all of these in, but maybe if you've discussed something, you might want to mark it as that. So we can obviously say that we've talked about handling and responsive feeding. And again, if we may have talked about feeding cues, positioning communication, position of tea, breaks in feed and cues for finished feed. For example, if maybe we've not talked about our bottle feed, obviously if we say no, that's also saying that we haven't discussed that at this moment. But there's options to be able to discuss it later. So we do save and close, and again, that conversation is there. So people can clearly see what you have discussed and what you haven't discussed. If you hadn't answered any of those questions where I've put no, it would just show the answers where you said yes. So again, another place would be postnatal education. So this is obviously mainly around baby care, or there is another section about a discussion with mothers. So obviously you've got a bit about perineal hygiene, analgesia options, things that we usually talk about during our discharge chat. So you also have that information in there as well. You can say that you have discussed nappy changing, and you've also demonstrated it as well. From this form, you also have a link to a safe sleeping assessment. You can do this separately. If you type safe sleeping, it will come up, but obviously in this case, this is something that we routinely do during a postnatal discharge. So this is just kind of being a bit more specific about what we've discussed as we've gone through. This does not replace, obviously, giving our safe sleeping leaflets, which people can access through the MapNotes app as well. So I'm going to save and close that, and I'll save and close that. So again, I can say postnatal education. It says that I've discussed nappy changing and safer sleep assessment. You can see that it's there, but I haven't filled everything in. So as we go further down, I'm going to show you some feeding forms. So these may not be in this list here, but they might be as well. So feeding forms, what I would recommend is doing enter new note, or on the iPad search and record and type the word feed. So it will bring you up with 5 specific forms, and I would recommend from experience of training that the feeding smart form seems to fit everything that we might need it for. So obviously we can see that it goes first into a little bit about how they're currently feeding. So we can say this is a feeding update. and we're talking about obviously the type of feeding. So this baby, obviously it was 28 weeks, so it was admitted to the neonatal unit. So we can say at this point we're doing expressed breast milk. Or actually we don't know. So this is obviously the type of feed that they are potentially having at that moment. But we're saying obviously that we want to breastfeed. So we can say obviously has the feeding initiated, and obviously we go through things at the bottom. There's also space to be able to record a frenulotomy assessment, and obviously about the actual procedure itself. It's obviously not appropriate for all of us, but there's a link to that for those that do frenulotomies. This information at the bottom has been completed at delivery, so therefore we don't need to complete that, which is why it's a grey colour. If we go to our feeding assessment, again we have to specify what type of feeding that person is doing, or we can do both, and again it brings up all of the different questions that are relating to that. It also calculates how many feeds that baby needs within those 24 hours according to its hours postnatal as well. So obviously in this case the baby's 26 hours, so therefore it's saying 3 to 4 feeds. It also calculates how many babies' nappies should be happening within that 24 hours as well. So again, that can be a good tipping point for you. So next section is our feeding plan. So again, these are really helpful to complete. It might be that we don't need to do any type of feeding plan, but obviously we are maybe doing it because they're reluctant to feed. Even something like putting a baby skin to skin and trying again in half an hour. In 30 mins. So when we've done that, in our baby section, when we have either our overview, we've got that feeding plan viewable there. We also have it in our summary of care. So you can see this feeding plan's been up to date here, and that feeding smart form goes into baby. It's also viewable on part of our pregnancy summary at the beginning as well, so it can be quite helpful to do. So if we want to go back to our feeding forms, the assessment, plan and update are all of the feeding smart forms but in separate forms. So if you just need to do an assessment on its own, then obviously you've got that form available. If you just want to do a feeding plan, access that separately, and again if you want to do a feeding update you can do it separately. There's also the option to do an observation checklist. So this will is basically a yes no answer question, so if you're looking at something specifically you can go through and see what you're seeing. There is no space for notes at the end of this, so I'd recommend then completing either a feeding form or adding a clinical note after you finish the observation. Again, that's an optional form, but it can be quite helpful if you want to make sure that you're ticking everything off as you go. So I'm now going to go back into my postnatal section and I'm going to record someone that needs anti-D. We can see from the top of our page that obviously this person is AB negative. So I'm going to click obviously back on our day and I'm going to add a new note. So as I go down, I have anti-D as a list here. So obviously we need to say whether it's required or not. If we put that it's not, we can obviously say that we've confirmed that the baby is rhesus negative, or obviously if the baby is rhesus positive, then we can fill out the rest of the form for giving anti-D. So we can say yes, the woman has no antibodies, what date and time we're giving it. So again, it opens up with the date and time that the form has opened, so you may need to change that. We've gained consent and obviously potentially we might be providing a leaflet or they may have already had one. So we have a location, our postnatal ward, and our indication would be postnatally. So obviously we have verified the patient's details, so we have obviously done it verbally, we've confirmed that they are who they are, and we've checked on a wristband, and we've probably checked on the drug notes as well. Obviously we would not be giving it to someone if they were unconscious. So our amount given, obviously we have a long list here depending on what is appropriate for them, and I believe it's 1,500 international units. Apologies if I'm wrong, it's been a while since I've been postnatal. So we have obviously space for the batch number and issue number. It would be handy to have that recorded there, so obviously we can follow up if anything goes wrong. So obviously we can record the expiry date, who has given it. So obviously in this case I will say I have given it, and the site that we've given it into, and have we given any extra advice about afterwards. Obviously normally we do a second checker, so I would recommend that we write the name of the person who is the second checker in our additional notes. There is no physical space for them to record on here, but we can write it on here, and obviously it will be on the drug chart as a counter signature. If we want to specifically sign that off with our electronic signature, we can authorize that. So on the iPad, you can authorize things with your passcode that you have set up. In this case, I have to put my username and password, and it's signed it off. So I do save and close, and my entity is added in there. So seeing as we're on the subject of medication, I'm now going to add some medication this person is on. So it should be in my list. So it's taken it away again. I've just got to refresh. So if I can't find it, oh, very top, there we go, medication. So obviously in this case, I'm going to say this person is having some paracetamol. So obviously a medication type. This does not replace our drug charts, or eventually what will come in will be electronic prescribing. But for the moment, we can obviously mark, as we would in the notes, that they are on these specific medications. So we can say that it's been prescribed, that obviously do we require a prescription? We'll say no, and what period we're in, so we're in the postnatal. So our medication reasons, so potentially in this case it will be analgesia, and our drugs on the very top of our list we've got paracetamol. If obviously this wasn't in this initial list, we can also search it as well. So it has a list of every drug that you can possibly think of. So we've got our paracetamol there. We can say what route we're doing it, so oral, what dose. We've got 1 gram, and how often we're doing that. So obviously 4 times a day. Obviously, is this a change to any existing medication? So obviously, if they were previously on a drug and they've got a new dose prescribed, then we would say yes. In this case, we'll say no. And obviously, we're going to say that it's a current one. Obviously, this means that they have now been taken off that medication, and you can write any clinical notes there. Every time you add one drug, it will automatically add in a blank form for you to be able to fill in. So I'm also going to record that this person has TTOs. So obviously we've got a TTO here, we are postnatal, and I'm going to say ferrous sulfate. So obviously our route, we're going oral, and my dose, I'm going to say 400 milligrams. So obviously in this case, it's not asking me for my frequency, so I could put twice a day as a note. And is this a change to existing medication? We'd put no. So obviously you can see it's added another one. If you want to add some more medication, we're going to save and close, and it's added them as separate forms. If we also go into our pregnancy summary, that medication is listed on that front page, so it is important to at least add in your active medication, that you've got it there as an overview. So going back to my postnatal section. So previously I discussed about obviously recording blood tests. So hopefully most of you know these by now, but obviously we have add new note. And if we scroll down, we have blood tests and microbiology tests. So say we're doing a blood test. What we've offered and explained, so obviously a big long list. So let's say we are doing an FBC, which is here. On the iPad, to say that these have all been accepted, there will be a button at the very bottom. In this case, on the desktop, we've got all accepted here. So it then fills it in for you in a later place. So we can say date and time offered when we've offered it, and who's offered that blood test. So when they've obviously accepted and when those bloods have been taken, so obviously you can say yes. If you're doing it at the same time as when you have said that you're taking, said you're filling in the form, you can obviously click that button and it fills in that date and time for you. So obviously your place that you are taking that blood. So I believe it's just ward. And obviously we can do current location because we're in the Royal Sussex. Or obviously if you were at PRH, it would come up with PRH. So with whom, so obviously midwife in this case, and taken by, oh, I've missed, there's a button there for current user, so it pops it in there quite quickly. If obviously that person had declined bloods, you could also record it in there. Once we are happy with all of our information we've added, we do save and close. So obviously if a few hours later that result we need to check on whether it's back, we can go back into our test and we should have the results viewable here eventually. At the moment this may not be working and we will let you know when it does start to work. Once we do have that result, we can obviously record it on here, so we can say whether we've reviewed them, our levels, and obviously whether we want to publish those results to the app. You can add a message as well, so obviously if you can put all normal, that's obviously in there as well. So I'll press cancel, and the form is very similar for microbiology as well, very similar, but your results are at the bottom. On the iPad version, it's a big long list like this, and obviously as you can see in the desktop version, you have it in two separate sections, three separate sections over there. So just be aware. Also, to see this section on the iPad, there should be a button at the bottom that says either edit or information. If you click information, you'll be able to see this screen. So I'm now going to put in a catheter. So potentially this person needs to be recatheterized, and we have a section down here for cannula catheter insertion. It covers obviously both, so you can say whether you're inputting a cannula or a catheter. In this case, I'll say catheter. So we'd fill in our date and time, we'd fill in our location and who's inserting it. And obviously we're saying why we're putting it in, and have other things been considered instead. So obviously in this case would be a urinary, what type, obviously indwelling. I'm unsure as to sizes, but obviously they should be viewable on the pack anyway. And then it takes you through all of the steps that you would need to use to insert a catheter in with aseptic non-touch technique. You can then say when the catheter is due, batch number, and whether they're recatheterized. So once I press save, again, that's viewable there. If I then want to remove this, so obviously if I go in here, at the moment I have my catheter, what I'm going to do is I'm going to do a TWOC form. So I don't believe this is in this list, which does happen in some occasions, so I'm going to add in here, but it comes under bladder care. So we have bladder care here, but if you do type TWOC, it does come up as well. So we are going to say trial without catheter postnatally, date and time catheter removed. So obviously we can mark that it's being removed. So we'll say T-tab. And how long it's been in, it would work out obviously hour length. At the moment it's minutes. So we can say obviously record that the first void has been passed within 6 hours, then asks you obviously information about that first void. If you then do a second, it asks you information about the second, and again about the third. Obviously if potentially they didn't pass it within that time, you could put it, so obviously if we do save and close, we could then put another bladder care note and we can record it as post-birth voids. So obviously we can write and say that specifically this is a prolonged TWOC and add that information in there. There's also a place for us to record when we potentially have discussions around contraception discussion. So again, we can write obviously about this information and have we talked about it as well. So we've obviously talked about, we may have talked about all the different things and we may have just gone undecided, or we might have said none. And then obviously we don't tend to give out much information on contraceptive choices, but we do direct them to the GP. So at least we've recorded that that discussion has taken place. And obviously that is in there as well, which is part of our discharge process. So obviously, as well as with my my TWOC and my bladder care, I might want to record my fluid balance. So I can search here and do fluid. And I can add my input and my output. So obviously if I say I've provided a water jug, 750 mils, and obviously at the moment they are not on any infusions. And they've also had a urine output. This is probably more for our slightly higher risk women, maybe on women and people, and maybe on labour ward. So let's say that they've done 250 output, and obviously spontaneous voiding, and we'll say either obviously urinalysis with normal, or you've got obviously all your different options, or you've got not performed. You can add any extra notes. So when you do save and close, obviously that adds in there. Then you also have a chart that is viewable in your chart section. So we have our fluid balance, and it will work things out as it goes. So obviously we can see that 750's gone in, 250's come out. So therefore we've got an hourly balance of 500 and a total running balance of 500. We also have access to that form from this chart, and we can click in an empty box and add a fluid note in that way. So lots of ways to add that. So I'm going to go back to my postnatal section. And I'm just going to do one last thing, and that is my VTE. So if I go again to add new note, I believe that is in there. And obviously we've got our postnatal VTE assessment. We do these regularly, so therefore obviously we want to update it as we go. So we've got our date and our time, our location, postnatal ward. So all of our antenatal risk factors will have carried forward. So we just need to fill in where things may have changed and important things. So obviously, have they had any enoxaparin during pregnancy? So we put no. Any family history, or have they got low risk thrombophilia? We'd say no. Obviously prolonged admission, in this case no, and any surgical procedure in the can't say it, I tried. So obviously as I go down, already we've identified that this person doesn't have any other comorbidities, but a little bit further down we have said obviously this person is a smoker and this person has had a preterm birth. So we just need to fill in our other sections. So have they got preeclampsia? Have they got a systemic infection more like? And again, did they have an operative birth? We'd say no. And COVID-19, no. So it's already identified that that person is intermediate risk VTE, and therefore they need prophylactic treatment for 10 days. You can also authorise and sign that off that you've completed that form. And you also have specific actions that you may have taken. So if obviously you've done low molecular weight heparin, so obviously you've got prophylactic or you've got therapeutic, and you've got your doses here as well with your weights. So let's say, for example, this weight is there, and obviously we can say all about what we've discussed. So save and close, and it completes our VT prophylaxis. Once we're happy with the day, or potentially when that person is going home, what we would want to do is we want to close this assessment. So if we go back into the postnatal assessment, and we close that down. So if we click anywhere on the form, it should open back up. So obviously we need to say that that assessment has ended. So obviously we do our T-tab, who completed it. And obviously if we are going to send any leaflets over on their personal care plan, and if they're happy to receive the leaflets on the MapNotes app, and obviously if they're going to be leaving or not. We can do save and close, and that closes it down. I believe if you leave it open, it will refresh and do a new one for every day of their stay, but once they are ready to go home, that's when we end that appointment. And any extra forms that are added after that will be added outside of this assessment. We're going to do a separate video on postnatal discharge, but I hope for now that is helpful. If you have any questions, my email is at the end. Thank you very much.